Hey everybody, I'm Dr. Perkins, a board certified OBGYN, and today we're talking about, do fibroids shrink after pregnancy? And I'm excited to talk about that because fibroids can be so overwhelming. And of course we want to know, well, what will happen to them after I deliver my baby? And so let's dive into that topic today. So in this video, we will briefly talk about fibroids, what they are and their prevalence. We'll talk about the hormonal shifts that happen during pregnancy and definitely postpartum after you've delivered your baby and how those may affect your fibroids. We'll talk about instances when your fibroids may not shrink after pregnancy, and we'll talk about treatment options for fibroids. And if you hang around till the end of this video, I have a special and free surprise that I'd like to share with you. So let's just hang around and let's talk a little bit, okay? Come on in. All right, so what are fibroids? Fibroids are so common. If you are a reproductive female in your reproductive years, meaning between puberty and menopause, between 9, 10, and 50, 55 years old, you are more likely to have fibroids than not. It is very common, up to 70 or 80% of females. And if you are a Black female, that's even higher. The likelihood is much higher for you. And so it is important for us to have these conversations because fibroids are real and fibroids can be problematic. If you're watching, you're probably either pregnant or you've recently had a baby and you know that you have fibroids. You know that you have this non-cancerous tumor inside of your pelvis, inside of your uterus. And you are probably trying to figure out how to get rid of them. And so I'm here to help you with that. Fibroids love hormones, and we are hormonal beings, and our hormones are constantly in flux. And this is what drives and helps fibroids to grow. And so there are specific times in your life where fibroids may grow the most. So puberty. Most people don't know during their early teenage years that they have fibroids, and that's true because most of them don't. But this is where the seeds of fibroids can start to grow. Now, fibroids grow from the uterine muscle, and we are born with our uterus, and the uterus is made of muscle fibers, a ton of them. Every now and then, these muscle fibers may separate from the rest of the uterus and abnormally develop into these hard balls. Literally, in surgery, you can knock these and squeeze these balls of tumor, and they're hard and they're bulging and they can be in your way. And so these fibroids abnormally develop from the muscle cells of your uterus. And so what happens with that? These fibroids will increase in growth with increases in your hormones. And so at puberty, you have an increase in your hormones, and this is where it starts. When you go through pregnancy, you have a ton of high levels of hormones in your system, and the entire pregnancy is the perfect platform for fibroids to grow. And most women will know and realize that their fibroids are getting bigger during pregnancy. Your regular menstrual cycles. This is another time frame where your fibroids may grow. In the first half of all cycles, estrogen levels can be at their highest. And if you ask me, fibroids, they may say, if they could speak, that their most favored hormone is estrogen. Estrogen leads to growth of all types of things. And so fibroids is one of them. In the first half of your menstrual cycle, when your estrogen levels are highest, your fibroids tend to grow a bit. But then in the second part of your periods or your menstrual cycle, your estrogens go down and your progesterones go up. The boost to the growth of your fibroids might stop until the next menstrual cycle. Between our menses and pregnancy, fibroids have the chance to be boosted and to grow a bit. And so that can make the biggest of a difference. Now, on the opposite side, after pregnancy, the second your baby exits your body, whether it be by a vaginal delivery or a cesarean section, The second your baby leaves your body, those hormones start to plummet almost instantaneously. And so if you had a super high level of estrogen in your system, it just goes on the decline. And then everything that lives off of that estrogen level will now see the difference and change. So your fibroids may either halt in the growth that it's been experiencing. They may shrink during that time frame. The lower your estrogen levels get, the more that they may shrink. And so 6 weeks postpartum, 6 months postpartum, 1 year postpartum, your levels and your fibroids may continue to get smaller and smaller. However, if and when your body begins to be fertile again, this is where your cycles may restart again. Your fibroids may now begin to grow again because estrogens are being released into your system once again. Now we know that we're hormonal. We know that fibroids love hormones. We know that after your delivery, your hormones will go down, your fibroids are more than likely to shrink. However, if your body is in a state of hormone dominance, specifically estrogen dominance, then you may actually not see much of a shrinkage in your fibroids. The reason is, if you are estrogen dominant, it means that you have an excessive amount of estrogens in your system. Now, what exactly may cause this? Prior to pregnancy, you may have been in an estrogen dominant state, which means that you could have had irregular periods, you could have had a lot of hormonal issues like hormonal acne, you could have anxiety and depression, you can have a lot of mood changes, you can have a lot of abdominal growth, or girth, I should say. You have a lot of additional or excessive fat or weight around your midsection. You may have a ton of different things that are linked with estrogen dominance. And what happens is that when you have an influx of a lot of estrogens in your system that are not equally balanced out by progesterone, then your body is in a hormonally dominant estrogen state, which feeds your fibroids. And so I just said a mouthful, but you may be wondering, well, how do we balance that out better? How do we get more progesterone in our system? If you're having regular menstrual cycles, meaning that you're having a period every month, you're having a period every 21 to 35 days, then that tells me that you're ovulating as you should. Why is ovulation important here? Ovulation releases an egg, and once ovulation occurs, this egg produces progesterones in your system. And so if you have irregular cycles where you do not have periods every 21 to 35 days, then what happens is that you're not getting the progesterone you need from the egg that is released when you ovulate. And so you end up having much more estrogen chronically for longer periods of time, leaving you in an estrogen dominant state. And what happens with that? All those estrogens are being absorbed by these abnormal masses and tumors in your uterus, and they're growing and growing and growing and growing, creating more of them and more possible complications by them. And so if you are in this estrogen dominant state, then you may have growing fibroids even in your postpartum period. And so there are things that you can absolutely do, and I'll tell you about that in a few minutes. What I do want you to know right now is that if you do have fibroids that are not shrinking postpartum, you may have worsening symptoms such as heavy bleeding on your periods. You may have more pains in your pelvis. You may have pain with sexual activity. You may have a lot of bloating and fullness or growth of your abdominal area. And this could be due to the fibroids. And so if you're curious about that, it is important even after you deliver your baby to keep up with your OBGYN and to do another ultrasound to look and assess what's happening with your fibroids. There's no other way for us to assess, except we can possibly do a pelvic exam with our hands. But Truly, if you want a measurement of your fibroids and to watch their growth, pelvic ultrasounds are the best way to do that. And so, in your postpartum period, have that conversation with your doctor and ask about getting another ultrasound in probably 6 to 9 months after your baby is delivered in order to reassess the state of your uterus and your fibroids. So as I mentioned that we would talk about, we'll talk about treatment now. What do we do about these fibroids? If you've now delivered your baby and your fibroids are either large, they're shrinking but not shrinking enough, or they're growing, and especially if you're thinking about a future pregnancy, the treatments may include a few things. The first is that if you want to help your fibroids to shrink more, there are things that we can do with radio frequency waves to help them to shrink. There are things that we can give you like medications that will help them to shrink, but these will not get rid of fibroids. So it's very important for us to understand that they may reduce in size, but there is nothing medicinally that can be given to get rid of your fibroids. You can only shrink or stabilize them. The only way that we can get rid of fibroids is by physically removing them. A myomectomy is a medical term for this. Myomectomy means removing those myomas, which is a medical term for fibroids. And so this can be done by essentially cutting and removing them from your uterus, which means an incision and a physical removal. That can be done like a C-section, that can be done robotically or laparoscopically, but you remove these fibroids physically. In between pregnancies is actually the best time to get rid of fibroids. But not all fibroids are problematic and not all fibroids need to be removed. And so talk with your provider to see if you are a good candidate for fibroid removal or for the medicines to help them shrink. I hope this makes a lot of sense. And listen, if it doesn't or if you have questions, please let me know below. As I promised, I have a free gift for you today. It is a copy of my ebook, Hormones Don't Lie, and I'm offering this to you free of charge. This is completely 100% free, all right? And if you'd like a copy, listen, Hormones Don't Lie, we are diving into more about our hormonal state, how we can impact them, the things that you can do holistically and naturally to help to stabilize our hormones so we have less fibroid growth, less endometriosis, less pains, less bleeding issues. We help our fertility. I mean, there's a lot that we can do with just this information. And so I'd like to share that with you. So please click the link below this video. You'll be directed towards getting this video and I'll send that right over to you. All right. Thank you so much for being here. Thank you so much for listening in. Like and share. And of course, if you have a question, like I mentioned before, just let me know below and I'll be sure to respond to you. Thank you for being here. I'm Dr. Perkins, a board certified OBGYN, and I live and breathe fibroids. So listen, there are more videos and more topics, so stay tuned. Much more to learn.